My name's Ben Jameson. I'm a GP and I'd like to talk to you today about the Health Inclusion Pathway Plymouth. This is a new initiative that's a collaboration between our partners in Plymouth to provide better healthcare for people experiencing homelessness and multiple deprivation. So for many years, we've known that people who are experiencing homelessness also face other challenges. So these can include addiction, infections, injuries, learning disability, and brain injury. These result in people requiring hospital treatment more frequently than other parts of the population. We know that many people who experience homelessness are frail at a much younger age and are more likely to die at a younger age. Plymouth is a very generous city. We've got excellent health services across the city, but joining those together isn't always easy.
So my name's Kate Howard. I am a community outreach sister. So my role is around the physical health of this cohort of individuals, so the homeless. The barriers generally for the homeless population are both intrinsic and extrinsic. So intrinsically, we're looking at that shame, that embarrassment, that feeling that they're being judged. The trust as well is a huge part of the relationship that we have to build up with these individuals. They've previously been treated poorly, they've previously had that judgment, and therefore accessing healthcare is a big thing for them. And they're also, sometimes they have chaotic lifestyles, and actually we have to respect that chaos. Our routines don't fit in with that chaos, and therefore we have to be a bit more adaptable, we have to be a bit more flexible about the services that we can offer to them.
My name is Mike Turner. I'm the support worker with the HIP team, and on a day-to-day basis I tend to help people access services, whether that be physically taking them to and from GP appointments, to the pharmacist, if they need to access the job centre or benefits, things like that. I'm there specifically to help them with day-to-day bits. So the Health Inclusion Pathway, as part of the Alliance, aims to provide a wraparound care so that people don't have to keep repeating their story, which can re-traumatise them. We work with other organisations within the Alliance, the Council, Harbour, BCHA, in order to make sure that these people have fair access to services, that they can get their benefits, they can get what they're entitled to, and also not be held back by their social circumstances.
There's a big thing at the moment about digital exclusion for this group of individuals. A lot of surgeries are now using e-consult as the only way to get access to GP appointments. Again, this is a massive barrier for our guys. They don't have access to the technology that we have access to. Some of them are illiterate and can't read what's in front of them as well. So there's those kind of barriers as well. There's barriers in that people who are released from prison aren't always told that whilst they're in prison, they're no longer with a GP surgery. So they then have to re-register with a GP surgery. So they go weeks without medication because they're not familiar of how to access that service again. So it's about bringing all that together and supporting to make sure that we really do our best to include our most vulnerable in society.
My name is Darren Lloyd. I'm the operational lead and I'm also the mental health nurse with the team. I've got 30 years experience as a mental health nurse. A lot of the people that we work with have got mental health issues in tandem with their physical health issues and their social issues. So I explore and work on those with them. Some of the misconceptions around homeless people is that it's a lifestyle choice, especially around drug and alcohol use. It doesn't take into account people's backstory, their lives. A lot of the people that we've worked with, if not all, have encountered trauma at some stage in their life and use drugs and alcohol or are homeless as ways of coping with that trauma.
I think Gabor Mate said that we will understand ourselves as we have been understood, we will love ourselves as we have felt loved, and we will also care for ourselves as we have been cared for as young children. And so if there's any level of neglect, abuse, relational dysfunction, these people won't have the same coping mechanisms.
If we take it right back to its core, one of the reasons that people experience homelessness is due to relational difficulties. And by relational difficulties, what I mean is they've not really had the opportunities or privileges at the start of their life that perhaps other people might have had. This leads to difficulty in being able to trust others. So, like thinking about trust and thinking about relational safety, then that really informs how engaged people are with services, with other people. And generally, if we think about substance use, the use of drugs, essentially that's a process of emotional regulation, and that fills the void that they're not getting through relational safety, and that sort of reinforces the idea of how trusting they need to be of others.
So at the moment we're collaborating with public health, with vapes, because our guys do not engage well with new teams. And at the moment we have had 30% of our population give up smoking. With smoking cessation, their percentage is 40%, so we're only 10% off what smoking cessation have done already.
So my name's Shona Rogers. My job is a peer researcher for the Health Inclusion Pathway Plymouth team, and my ultimate goal is to get research from patients about their experiences with the team and things that we can do better. You can look at statistics, and I'm sure the government do that, but I think the real, true voice of somebody that's had lived experience is really powerful, and they can suggest ways that the services can be improved as well. And they're the ones that have used them, so they know exactly what's right and what's wrong.
It's incredibly difficult to navigate the health system for people who are experiencing multiple deprivation. And that is why we've come together as University Hospitals Plymouth, Live Well South West, One Devon, the Plymouth Alliance and Plymouth City Council, together with primary care, to form a response that is appropriate to people's level of need.
We've built a lot of relationships, we've built a lot of familiarity between different services. We've got our name out there so that people know what service we offer and what it is that we do. I think one of the biggest things that we've achieved is bridging that link between primary and secondary, so having a hand on the community as well as in reach at Derriford.
We're not a panacea, we're not going to go in there and solve all those problems in one go. It is about looking at step-by-step approach, really. The biggest challenge for our service, but also my biggest hope for our service, is that the wider network has a greater understanding of the needs of our client group. So I think the biggest work we can do is to be that advocate.
I would like to see more funding for our homeless population. I would like to see more housing options for our homeless population. I would like to see more staff doing this role. There's only a certain amount of us in the city. I think the more people that are invested in making the changes and helping these people, then it's only going to make the service better for them long term.
It's absolutely essential that services across the city recognise the levels of need experienced by people who are homeless. So it's really exciting that our system is coming together in this way, because this will mean that it's less likely that people fall through the cracks, and that we can work towards sustained recovery for people so that they don't have to experience this cycle of homelessness, addiction, poverty, hospital admission and ill health.